An abdominal aortic aneurysm AAA is a swelling in the aorta, the artery that carries blood from the heart to the tummy, abdomen. Most aneurysms do not cause any problems, but they can be serious because there's a risk they could burst, rupture. What are the warning signs of an abdominal aortic aneurysm? Symptoms of an abdominal aortic aneurysm: pulsating feeling in your stomach, abdomen, usually near your belly button. That's usually only noticeable when you touch it. Persistent back pain, persistent abdominal pain. How do you diagnose an abdominal aneurysm? If you have abdominal or back pain, an ultrasound can check for an abdominal aortic aneurysm or other possible causes of your pain. Once an aortic aneurysm is seen or suspected on ultrasound, you may have a CT scan or an MRI to provide more details about the shape or location of the aneurysm. What are the 3 most common causes of abdominal aneurysms? Risk factors: tobacco use. Smoking is the strongest risk factor for aortic aneurysms. Age: abdominal aortic aneurysms occur most often in people age 65 and older. Being male, men develop abdominal aortic aneurysms much more often than women do. Being white, family history, other aneurysms. How long can you live with aortic aneurysm? When left untreated, ruptured aortic aneurysms are almost always fatal within several hours to a week, depending on the size of rupture. What is the best initial test for abdominal aortic aneurysm? In the minority of patients who experience symptoms, abdominal, back, and groin pain are typical. Ultrasound remains the definitive test for initial diagnosis and screening. Imaging with computed tomography, angiography, or magnetic resonance. Angiography is used for anatomical mapping to assist with operative planning. What is the most common cause of abdominal aortic aneurysm? There are several causes of abdominal aortic aneurysm, but the most common results from atherosclerotic disease. As the aorta gets progressively larger over time, there is increased chance of rupture. Aortic rupture: a tear in the aorta, which is the major artery coming from the heart, can be seen on a chest X-ray. What is the triad of an abdominal aneurysm? The classic triad: hypotension, back pain, and a pulsatile abdominal mass are present in only 50% of those people with ruptured abdominal aortic aneurysms AAA. Large unruptured aneurysms are quite often asymptomatic and are often found incidentally on physical or X-ray examination. What is the most common site of abdominal aneurysm? Aneurysms occur most often in the portion of the aorta that runs through the abdomen. Abdominal aortic aneurysm. An abdominal aortic aneurysm is also called AAA or AAA. A thoracic aortic aneurysm refers to the part of the aorta that runs through the chest. What is the most common location of the abdominal aortic aneurysm? In the abdominal aorta, the most common location of an AAA is just below the renal arteries. The most common complications arising from an abdominal aortic aneurysm AAA include pain from ischemia, thromboembolism, spontaneous dissection, and rupture of the aneurysm leading to hemorrhage and possible death. Are there warning signs days before an aneurysm? Symptoms of an unruptured brain aneurysm: visual disturbances, such as loss of vision or double vision, pain above or around your eye, numbness or weakness on one side of your face, difficulty speaking. What not to eat with abdominal aortic aneurysm? Popular foods that are bad for your aortic health include the following: fatty meats, such as red meat, fried foods, refined, white carbohydrates, sugary drinks, such as soda, fatty oils, such as margarine and butter, processed, packaged foods, high cholesterol foods, full-fat dairy products. Can vitamin C shrink aneurysm? Vitamin C attenuated the development of AAA, decreasing maximal aortic diameter, by 25.8% P0.05 and preserving elastin lamellae. P0.05. Is walking good for aortic aneurysm? Aerobic activity increases your heart rate and breathing. Try to build up to doing 150 minutes week of moderate intensity activity like a brisk walk, light cycling, or water exercise. Don't exercise at a high intensity. Can you fix an aortic aneurysm without surgery? Aortic aneurysm repair with stent grafts at UVA Health. Here, we can offer you aortic aneurysm repair without major surgery. You can avoid big cuts on your body and a long recovery time. We can put in a stent graft, a metal and fabric tube to support your aorta. The procedure only uses a small cut. What side is your abdominal aorta? Left. The abdominal aorta enters the abdomen, posterior to the median arcuate ligament, and lies anterior and slightly to the left of the anterior aspect of the lumbar vertebrae, with the inferior vena cava lying to its right. What is the new treatment for abdominal aortic aneurysm? Boston, May 10, 2023. The intravenous delivery of immune-modulating cells may someday slow the expansion of bulges in the aorta, known as abdominal aortic aneurysms. A second study found evidence that a COVID-19 infection may promote the enlargement of these dangerous bulges. Can ECG detect aortic aneurysm? Aortic aneurysms. The aorta is a major blood vessel that delivers blood from the heart to the rest of the body. If an aneurysm bursts, blood can leak from the artery, causing a life-threatening emergency. An EKG can help diagnose and monitor aortic aneurysms before they burst. Can abdominal aortic aneurysm be cured? The greatest concern with an abdominal aneurysm is that it may rupture. The larger the aneurysm is, the greater the risk of it rupturing. Aneurysms that rupture can cause severe internal bleeding, which can be fatal. Fortunately, this condition can be successfully treated and cured when diagnosed prior to rupture. What is the biggest risk factor for abdominal aortic aneurysms? Cigarette smoking is one of the main factors that increases your risk for an aortic aneurysm, especially an abdominal aortic aneurysm. If you are a current smoker, an abdominal aortic aneurysm may grow more quickly and be more likely to burst. What size aorta requires surgery? If the echocardiogram suggests any aortic disease, it should be followed by a CT scan. Once an aneurysm has been identified, a decision must be made regarding when it is time for surgical intervention. An ascending aortic aneurysm greater than 5.5 centimeters requires surgery for all patients. How long can a person live on abdominal aneurysm? Patients with AAAs larger than 7.0 centimeters lived a median of 9 months. A ruptured aneurysm was certified as a cause of death in 36% of the patients with an AAA of 5.5 to 5.9 cm, in 50% of the patients with an AAA of 6 to 7.0 centimeters, and 55% of the patients with an AAA larger than 7.0 centimeters. What size AAA requires surgery? Surgery to repair an abdominal aortic aneurysm is generally recommended if the aneurysm is 1.9 to 2.2 inches 4.8 to 5.6 centimeters or larger, or if it's growing quickly. Repair surgery also may be recommended if you have symptoms such as stomach pain or have a leaking, tender, or painful aneurysm. How big is a normal abdominal aorta? The normal diameter of the ascending aorta has been defined as 1 centimeter per square meter, and of the descending aorta as 6 centimeter per square meter. The normal diameter of the abdominal aorta is regarded to be less than 3.0 centimeters. The normal range has to be corrected for age and sex, as well as daily workload. Can you fully recover from an aneurysm? With rapid, expert treatment, patients can often recover fully. An unruptured brain aneurysm may cause 0 symptoms. People can live with them for years before detection. If a brain aneurysm is unruptured, No blood is broken through the blood vessel walls. Thank you for watched my video. Please subscribe my channel.